Again, you want to try to stay in the hypothetical. I think you want to avoid saying, why don't you go to the gym, or seeming accusatory, or let's change your behavior. But it's really more focused on someone struggling with suicide, someone struggling with depression. What are some things that that person might do? And keep in mind, this could be a group setting or an individual setting, depending on your numbers at campus and how things kind of play out. Jason, what might be, if you could think of a scenario where a student might benefit from this short-term kind of suicide approach?
Yeah, and what comes to mind, immediately is the late night type of call that we get from a roommate or someone like that saying, I'm really concerned about my roommate because my roommate has been depressed, has been hanging out in the room, has said some things about not wanting to be here, or some things that are vague suicidal ideation type things.
These are actual situations that have happened at one or other colleges, and I'm sure everyone has their own kind of take on this case. What we're dealing with here is a behavioral disruption. I think we all know not to say we're going to intervene because the student's depressed. We're intervening because behaviorally they're causing a disruption in the residence halls.
And this would be a situation that would significantly affect the resident assistants and area coordinators and who was ever dealing with this case, and would involve calls up, and the police were clearly involved.